I have heard you say that 1 in 7 men who see a urologist already have irreversible bladder damage.
It's crazy, but we did a big study where we looked at men visiting the urologist. We tested them, and they tested in this zone where we called, basically the bladder was no longer squeezing like it can. So the bladder, put simply, is a big old pump. And over men's lifetime, the bladder has to empty through the middle of the prostate and out the urethra. So as women get older, they don't have problems with the pump getting weak because their urethra is relatively short and they don't have this prostate, which can get bigger with time. But men, they have a prostate which gets bigger as we age. So very similar to problems with erections. So 50% of 50-year-olds will have an enlarged prostate, 80% of 80-year-olds, so on and so forth. And of the men with an enlarged prostate, half will be symptomatic. So if you have this pump, which is struggling to empty because it's trying to squeeze urine through the middle of this donut, which is the prostate, the bladder gets tired after a while. It's a pump that fails. And if men allow that to progress, 1 in 7 come to me and the pump's already gone. What does that mean for them? Well, either they will need to catheterize the rest of their life to get the urine out, or either in and out or have a catheter in, or they'll need a very aggressive surgery in the hopes that they'll be able to pee on their own by what we call crit avoiding, bearing down,
I remember
basically
that.
just pushing the urine out. So it can be avoided if, when men get symptoms, they go to the doctor relatively early, and either they get a surgery early, because that's the best way to preserve the pump.
What would the symptom be? That they are just getting, would it be urinary retention or this feeling where they're having to go a lot, but they can't go, and feeling like there is urine still, that they still have to pee?
Yeah, it's the former. It's pushing or straining to go. Men who can't empty their bladder effectively, right? So one test we'll do is we'll have guys pee into a machine. We'll measure how strong the stream is. We'll give them a score. And that can be predictive of the need for surgery, et cetera. But more importantly, we measure how much is left behind after they go. And if that number is 0, you're good. However, if that number starts climbing, you pee out 400, you leave 100 behind. You wait another year, you pee out 300, you leave 200 behind. Pretty soon the ratio is nothing comes out and you leave everything behind. So that is the best way to kind of predict this loss of bladder function, is by seeing how much is left over. Other signs can include knowing you're not emptying. So that can sometimes lead to frequency, getting infections, right?
Urinary tract
infections, because our number one defense against infection is peeing out the bacteria. And if you are not emptying your bladder well, basically there's like a little swamp in there where the bacteria are like swimming around having a field day, and then manifesting with infections.
How would a woman know that she has the equivalent?
Women will very rarely have these obstructive symptoms because they don't have the hardware to cause the bladder to malfunction. But the important lesson here is that, the bladder causes this mischief. It wants to squeeze all the time. And there are many lifestyle factors that lead to more bladder mischief and make me have to pee more often and make you miserable. So sometimes men will come to the urologist saying, "Doc, my prostate's horrible." And no, they have the same thing that women have, this overactive bladder. Urologist's job is to separate like what the problem is. But for men that have struggling to urinate, you have to rule out the pump problem. Because if you don't, you're going to have to get a catheter lifelong, and that's not what you want, believe me. In terms of, what can we do about the overactive bladder, this kind of irritative symptom type of thing, not pushing or straining, but having to go often, running to the bathroom, having to get up in the middle of the night, like basically having accidents when you don't want to. These are bladder behaviors. So
not prostate behaviors.
That's
we have to talk about this. We need to clarify this. You have also said, which I thought was brilliant, how many times you pee in the middle of the night can predict the likelihood of death.
So big meta-analysis, I think from 2015. Meta-analysis is when you take all the best literature, you combine it, and you try to come up with conclusions. So this meta-analysis said that men who have nocturia, that's greater than 2 times at night, they get up 3 times a pee or more, are 30% more likely to die of all causes. Heart attacks, these kind of things. Now, does that mean that if you pee 3 times in the middle of the night, you're doomed? Of course not. This is not a causal relationship. It's a correlative relationship, meaning the answer probably is that if you're getting up 3 times in the middle of the night to pee, you've got other stuff going on. 1, do you have sleep apnea, where you can't sleep soundly, and that's making you pee more often? 2, do you have edema in your legs because you have heart failure? You have to pee more often in the middle of the night. 3, do you have metabolic abnormalities? You have diabetes, which makes you pee more often. all these kind of potential risk factors will make you pee more. So it's the fact that you're peeing tells me you're unhealthy. If you mitigate that unhealthiness, if you lose weight, you start to exercise, you reverse your diabetes, guess what? You won't pee as often, right? So a lot of these things are reversible in life. With human body's amazing if we treat it right.
Is there a normal amount of time someone gets up? And again, I'm thinking about my dad. Shout out to Nate in Ecuador, probably embarrassed. You know, he often says, okay, well, I'm waking up in the middle of the night, 2, 3. Again, he lost me at 3 to go to the bathroom.
Yeah.
He is 74.
Yep.
Would that be prostate? Would that be bladder? Would it be impossible to tell?
Yeah, so it's typically unusual to have to get up in the middle of the night less than age 50, right? Once, fine. But once you start getting up more and more often, we know as we get older, again, the bladder loses capacity. As we get older, we tend to make less hormones that prevent us from peeing in the middle of the night. Specifically, we make less ADH. If you have sleep apnea, the body perceives this lack of breathing as high blood pressure to the chest. And so it sends out natriuretic peptide, which makes us spill salt into the urine, which pulls fluid with it. So again, these other medical comorbidities will make us have more nocturia. So I'd say if you're getting up more than 3 times at night, you first should look at lifestyle factors, and then obviously look to improve the other metabolic components that we just discussed. But yeah, you're at risk for other things because that's a warning sign that stuff's going on.
It's really interesting because just, again, as a practicing physician, training in, say, family medicine and even geriatrics would be, here's some Flowmax. I'll see you next time.
It's a very dangerous approach. One, you're making the assumption that it's the prostate. It could be bladder. It could be the fact that this person's drinking 8 liters a day. And we can talk about bladder irritants in a second.
We are definitely talking about bladder irritants because you just killed half the list.
The other thing, though, is that Flomax is a drug that, it's Tamsulos. And there's all these other drugs which will improve the strength of the stream, but it doesn't protect the pump. So actually the worst thing you can do for guys with obstructive symptoms is to give them Flomax, because then you won't see them again for another 10 years. But by the time they've come back, now the bladder has had the damage that's irreversible. So Flomax is not a drug that will protect you long term. So if you have true prostate enlargement, I'm an enthusiast for early intervention, that is doing procedures that will help take away some of the resistance in the prostate so men pee better and they protect their long-term bladder function. You can use medications to have this effect as well. And these drugs are typically 5-ARIs, the ones that actually physically shrink the size of the prostate, kind of a chemical surgery, if you will. These drugs will prevent the need to go to the emergency room because you can't pee, the need for surgery in the future. But if you just give somebody Flomax and say, see you when I see you, you're at high risk for having that person have long-term bladder damage.